there are lots of healthcare professionals all over the world that are looking for new ways that they can upskill themselves, how they can get better. Now, when we're thinking about the digital age, which is upon us, how are we upskilling our healthcare professionals? How are we making sure that they have the skills that they need to get the job done? If we're not upskilling our workforce, especially within healthcare organizations, then we're going to start to have some serious issues. If you're thinking about, failure to actually leverage technology, if you're thinking about reducing, the competitive advantage of having a really technically advanced workforce, if you're thinking about efficiency savings, good quality care, the list is it just keeps going, right? And the reason is, if you have a really skilled healthcare workforce, then there are benefits for patients, for healthcare workers, for the organization, for society. So it's a no-brainer. So in today's video, what we want to do is just explore 3 key reasons why good quality healthcare training is really important. Don't forget to subscribe as always. So guys, each year, the economy of the world is going to spend like billions and billions of dollars on healthcare education to try and upskill the workforce. And the reason why this is because we recognize its importance in moving care quality forward. And really what you're trying to do is to spend money, to save money, and to improve quality care. Because if you're not improving quality care and you're not delivering the sort of high standard of care that's needed within your healthcare ecosystem, then you're going to find a lot of issues. So number one, we can think about how are we going to enhance patient safety. It's really about care quality, isn't it? Good staff tend to give you good outcomes. Bad staff or staff that are not well trained are certainly not going to give you the types of outcomes that you're looking for. And if you're a healthcare worker across the world, what you're really thinking about is, do I have the competencies? Do I have the skill sets to always deliver the good quality care that my patients need, that my healthcare users need? And I know from interacting with healthcare users all over the world that, they're always looking for new opportunities to like upskill. And sometimes it's down to the individual. We know that. Sometimes it's down to the organization. They need to do more in such instances. And other times it's down to like policies and procedures and governmental level sort of initiatives. And we know from time to time, there's always that disparity between what the healthcare workers need and what the governments of that local country actually provide. And we need to bridge that gap and make sure that our healthcare workers have the skill sets that they need. Number 2, it's really about adaptation to technology. I've done videos on this before. We know that technology is basically taking over when you're thinking about the healthcare ecosystem. So we have to think, okay then, if we're training our staff to use this technology properly, then we're going to get the outcomes that we're looking for. I've done consultancy in healthcare organizations. You get there and you realize they spent massive amounts of money on tech, but people don't know how to use it properly. And there's lots of statistics out there on the percentage usage of technology within organizations. So you might have an organization that has all the tech, but very few people know how to optimize it and use it effectively. So that's another real important reason, especially with AI, why you need to upskill your workforce. The final one is around resource optimization. What we're really talking about here is that managing money is key, right? We all know what's going on in the economy at the moment. Things are really, really tight. And so if you're a healthcare organization, what you want to be thinking about is how can we optimize all of the resources that we allocate to this particular institution? And one key way to do that is to invest in your most expensive and your most valuable resource, which is your human resource. If you can optimize your human resource through training and development, certainly that human resource is going to be optimized to deliver efficient, good quality care. That's what it's really all about, isn't it? So if you think, let's cut costs, let's do things on the cheap. When it comes to training, doing things on the cheap gives you cheap returns. Cheap returns are the types of returns that people don't invest in. And so it's really important as a healthcare worker to think, okay, then how can I upskill? How can I get those skills that are needed? As a healthcare organization, how can we make sure our employees, our most valuable resource, has all of the skill sets they need to deliver 110% for us? And we know the massive impact that's going to have on society. Okay, guys, so those are the 3 reasons why good quality training is really, really important. So when you're there and you want to think about, okay, then what does training mean to me? At the individual level, it is about upskilling. It is about improving your competency. For organizations, it's about how you are going to become more efficient, more effective, and deliver that good quality care that your patients need. Thank you so much for connecting. Thank you so much for engaging. And thank you as always for exploring this episode of Leading Health with Dr. Atom. Stay interconnected.